they're putting a light rail through the hospital. We've got a very vulnerable population of patients here, and we're concerned for their safety.
There's got to be a better way than driving it right through the middle of this hospital.
We've got construction work going on now. They're rebuilding a new unit that they're going to knock down the old unit to make way for the light rail. There's workmen all over site, and all this has happened with no consultation with any of the stakeholders regarding the hospital.
This light rail is just an excuse to uplift and rezone land for sale. It's a no-win situation for anyone bar developers.
And of course your hospital has been neglected for years on the basis that there's a plan for the future to be up the road in a different site. And yet they've not allocated the funds to do that. And instead, you've got this crazy idea that you run a train through the middle of it.
It's going to be a double tram line, and it's going to be running every 7 minutes between 7 a.m. and 7 p.m. Any medical emergencies, any aggressive emergencies, we've now got to wait for a light rail to pass through before we can access that other side of the campus.
To have infrastructure, two big heavy pieces of machinery moving in here, there'll be dire consequences.
I understand your level of concern about how the hell do you make sure that nobody's going to jump in front of those trams.
We want answers, we want risk assessments done.
We want to make sure that your workplace is safe for you and for the patients of Western Sydney who depend upon Cumberland Hospital and the mental health services in this district to survive.